Welcome to today's Sight and Sound Bites webinar. We have a robust program with 3 speakers today about something very exciting, rewarding, and something close to my heart personally. So thank you for being here. We have quite a program today for today's webinar. We have 3 speakers. I'm thrilled for all of them to be joining us, talking about pediatric vision, childhood vision, and some exciting collaborations that we're working on here at the Eye Foundation at UPMC. So I will just say hello and welcome. Again, thank you for joining us. I'm Carrie Fogel. I am the Senior Director for Development and Foundation Relations here at the Eye Foundation, and I will be moderating the discussion today. As you know, Eye Foundation hosts these featured talks every month on different topics in vision loss, hearing loss, head and neck cancer, sinus allergy, balance disorders, and voice conditions. So today's presentation will focus on childhood vision and the UPMC Western Pennsylvania School for Blind Children garden collaboration that we have at our new Vision Institute at UPMC Mercy Pavilion. I'm excited because, as you know, a lot of these webinars focus on research topics in science, and there will be a component to that as there always is as part of today's program. But something very exciting is that we have 2 individuals coming to speak about a partnership that formed out of kind of a relationship that the Eye Foundation has with the Western Pennsylvania School for the Blind, and finding a way that their student population can be involved in the work that we're doing at the Vision Institute. So I'm very excited for you all to hear about that. Just some quick housekeeping. We aren't using the chat function today during the webinar, but we do ask that you submit questions to the Q&A box at the bottom of your screen. You can submit them at any time throughout the program, and I'll make sure that we ask them to the speakers at the end of the program. Any questions that might be left unanswered during the Q&A will be sent to the speaker that it pertains to, and an email answer will get to you following the program. And as always, there will be a video of today's webinar available on our website following the talk. So we have 3 speakers today. I'm thrilled to introduce Dr. Preeti Patil. Dr. Patil is a pediatric ophthalmologist and neuro-ophthalmologist. Her primary clinical and research interests lie in neuro-ophthalmic conditions such as cortical visual impairment, which we'll be talking about today in children, and idiopathic intracranial hypertension. Dr. Patil also runs a Nystagmus clinic at Children's Hospital in Pittsburgh and is interested in the management of this complex condition. Our next speaker will be Dr. Rachelle Rectenwald, who is currently the Assistant Superintendent at the Western Pennsylvania School for Blind Children in Oakland. Dr. Rectenwald first began at the school as a volunteer in the 1990s while attending the University of Pittsburgh and helping teach the students there how to swim while she was there swimming for Pitt in 1990. She then became a full-time para-educator in 1992 and completed her bachelor's in 1993. And then she went on to earn her master's with a dual certification as a teacher of the visually impaired with a certified orientation and mobility specialist certificate. And in 2005, she completed her supervisory certification in special education and welcomed a new role in administration. And our third speaker is Roberta Kiefer. Roberta is the manager for UPMC BMS Grounds, and her teams cover the Presby, Oakland, Shadyside, and Mercy campuses, as well as many corporate properties. Roberta has worked for UPMC for over 16 years and has a background in landscape design and installation, and she has participated in many community partnerships and facilitated the design and install of therapy gardens throughout her coverage area. So this is a great lineup we have today. Again, something near and dear to my heart personally. So I'm going to hand it over to Dr. Patil to start kind of with some of the clinical work, and then we'll move on to the collaboration. So Dr. Patil, over to you.
Hi, good afternoon, everyone. And thanks again for having me. It's always wonderful to share some of our work with you all. So I'm going to talk a little bit today about vision impairment in children, CVI, that's cortical visual impairment, and a little bit beyond. So just speaking about this wonderful, wonderful resource that we all have in Pittsburgh, we're really lucky to have the Western Pennsylvania School for the Blind Children so close, so close by, and it's such a wonderful resource for our kids. The school sees children with low vision. Now, this can be because of multiple causes, and I just wanted to touch upon some of those. So it can be causes related to the eye itself, where there's been an issue, either that the child was born with or something that they developed, like a retinal dystrophy, which are genetic retinal conditions that cause poor vision, corneal conditions, which is the front of the eye that can cause poor vision, retinopathy of prematurity, which is a disease of the retina that premature kids get, which if untreated can result in blindness, optic nerve atrophy and optic nerve hypoplasia, which are conditions that affect the nerve at the back of the eye, and that can cause blindness as well. And then one of the commonest diagnoses, from what I know, of the population that the school caters to is something called CVI, which is traditionally referred to as cortical visual impairment, now called cerebral visual impairment, or even brain-based visual impairment. It goes by several names. So I'm going to touch a little bit on that more in detail. So just to start with, what is CVI? So we know that vision, as we know it, is not just the eyes. The eye is like a camera. It captures everything, but it takes that information back to the brain, and the brain then interprets it for us. It tells us what we're seeing and where we're seeing and what the relationship is of the stuff that we're seeing to each other. So CVI refers to an issue where the vision impairment is coming from the brain and not from the eyes. So it's characterized by bilateral visual acuity or visual field loss, which means there's low vision, but in the presence of a normal eye exam or a near normal eye exam where the vision loss is of a greater degree than would be expected just based on the ocular pathology that you're seeing. So there may be something a little bit in the eye that's an issue, but the degree of vision impairment is far greater. It is said to occur from damage to the post-geniculate pathways. This is what it means for the vision pathways in the brain after the optic nerve. And it's referred to, like I said before, it's not just cortical, but cerebral, which is said to involve a larger region, the whole cerebrum. And then now people even think it's not just the cerebrum. So it's an even broader umbrella term. It's called BBVI now, or brain-based visual impairment. Some of the newer scientific literature uses that term as well. So in the United States and most of the other developing countries, CVI is actually one of the commonest causes for vision impairment in young children. Children with CVI have a large spectrum of visual disorders, and this can include poor vision, complex visual processing deficits, where they might have trouble processing certain visual scenes, visual field defects, that's loss of peripheral vision, facial recognition and spatial recognition, color and contrast recognition defects. And some of these kids actually may have pretty good visual acuity when measured by the traditional methods, but may suffer from complex other visual issues that are often difficult to diagnose. Now, what causes this? There's a whole host of causes, but the most common one that is seen in clinical practice is a perinatal hypoxia. So that's perinatal or postnatal, that's just around the time of birth, just before, during, or just after birth, a lack of oxygen in either preterm or even full-term children that then causes damage to the areas of the brain that are involved in visual processing. Other causes include hydrocephalus, which is increased fluid in the ventricles of the brain that causes swelling, trauma, including non-accidental trauma, infections of the brain, such as meningitis or encephalitis, metabolic or genetic disorders that affect the central nervous system, drug exposure while in utero, structural brain abnormalities, which can be congenital defects that the child is born with, and of course, a seizure disorder. Now, how does this child present? So these are clinical scenarios from what I've seen in my clinic. So a young mom who might bring her 6-month-old baby to our clinic saying, my baby just doesn't look at me. He won't smile at me, but my other eye doctor says his eyes are fine. So why is this happening? Or parents who might bring in their 5-year-old son who just started kindergarten, and they say he's really scared. He looks like he's anxious and scared in his crowded classroom. He's having trouble reading. He finds it difficult to play with his friends when they all play together and there's so many toys. But when I took him to our optometrist, they say his eyes are okay, and what can we do to help him? So how does the child present? Now, CVI, we have to remember, is a large spectrum. You could have severe vision impairment or very minimal vision impairment. And so depending on the extent of CVI, the children might present differently. You might see the obvious poor vision where there's a lack of eye contact in babies, inability to recognize faces or see objects clearly, the tendency to gaze at bright light and just keep looking at it, especially in little babies. Or challenges with a complex visual sort of an environment. So we almost call it visual crowding, where it's too much. If there's too much visual stimulation, it's too much for the child to process. So challenges with complex visual input, such as seeing an object on a patterned background might be difficult. So seeing a red toy on a red carpet in a red room might be too much, versus seeing a bright red toy on a white carpet without a pattern. They often like to view objects at a close range. They might have defects in their peripheral vision, especially the lower vision fields. So they might stumble, have difficulty going down steps because they can't see the lower area here. Light sensitivity sometimes, and ocular motor deficits with moving their eyes as well. These are just some of the classic features. So in little kids, like finding a toy in a toy box with many toys in it, finding an object on a patterned background, um, finding food on a plate or a distant object. They might have trouble with floor boundaries or uneven surfaces, trouble with steps or getting on the curb. And they might get frustrated if they're distracted while they're trying to do a visual task. They might also have trouble with recognition, so recognizing people either in person or in photographs, especially in a crowd, interpreting facial expressions, recognizing shapes and objects, and they might get lost in environments which are complex to navigate, especially new environments. So how do we diagnose it? CVI manifests in many ways. And so the diagnosis is sometimes difficult, and it really is important to keep an index of suspicion, because remember, the eye looks normal. So if you just look at the eye and you examine the eye like you would otherwise in a routine eye exam, everything might look just fine. So in children with CVI, with complex neurologic problems, sometimes the diagnosis is easier because you already know they're dealing with other neurological issues, and hence you suspect that visual processing might be an issue as well. In children who are otherwise apparently normal, some of the signs may be subtle. A detailed history taking is really important. There are several caregiver questionnaires that have been developed, and we have some research that we've just concluded where we've used one such questionnaire that was developed by Dr. Dutton in the UK. And that's the questions that you can ask the caregiver, the parent, or the guardian, and you can get answers to those questions that might hint towards CVI. There's something called the CVI range that was described by Dr. Roman that also tells you how to functionally assess for CVI. Specific questions directed at these visual behavior differences that we just touched upon briefly. Of course, a complete ophthalmic exam, assessment of peripheral vision or the visual field where possible, electrophysiology, and the neuroimaging, like getting MRIs, etc. I just wanted to touch upon briefly what's the role of an ophthalmologist or an eye doctor. Of course, to get vision assessment, to try to assess vision in these kids, which sometimes can be very difficult, you might just be able to figure out if they're able to follow light or fix faces. These here are pictures of some of the tests that we use in little kids who are not verbally able to read letters or numbers of a chart. You can use these shapes. You see those little gratings there at the bottom. They are of different contrasts, and they're cards that can be held up to see what the child can see or look at. So there are ways we can judge visual behavior even in very young kids who are unable to read off a chart. A full eye exam is really, really important to make sure that the child does not have nystagmus, which is a condition in which the eyes bob or shake all the time. Strabismus, which is eye misalignment, where the eye may be turned in or crossed out. Accommodation and convergence, which are abilities of the eye to focus at different distances. A refraction, which is basically to test to see if the child needs glasses, if there's any associated far or nearsightedness or astigmatism. And then how do you manage this? So as an eye doctor, we know that we have to optimize vision in these children. They already have issues with processing the vision. So we have to do what we can to get them the best vision that we can. This might be as simple as giving them the correct glasses, sometimes bifocals. If there is lazy eye or crossed eyes or eyes that are misaligned, and if there's surgeries that we can do or Botox injections that we can do to try to help correct these, that's something we do. Eye patching if needed, and then management of the eye shaking. Some of these children have different head positions that they use because of the eye shaking, and there are surgeries that we can do to manage that and help them see better. And of course, to diagnose any other eye-related issues that might be contributing to the vision loss as well. And then the most important referral is really where our colleagues at the school come in, is where we would refer for functional vision assessment and early intervention, which is truly, truly the key to get these kids to start using their existing vision to their fullest potential and to get trained to use this vision effectively. So this is really a team approach where the ophthalmologist is just the beginning of making the diagnosis. The teachers for the visually impaired are absolutely key. And then, of course, the pediatricians and the other rehabilitation specialists, including OT and PT. Just wanted to touch a little bit upon some of the strategies that we may be able to use to help these kids see better. This includes using their vision and strengths after the functional vision assessment. So simple things like using black backgrounds to eliminate complex environment. The materials can be chosen depending on the child's preferred color and presented to the area of his peripheral vision that they can best see. Using light to direct vision. Using backlit devices to see. Interventions at school can include printing worksheets so that we adapt it to using less words on a sheet so it's not crowded, using clean fonts, making the spacing good, high contrast, even using backlit devices, etc. And I'll just stop here and I'll let my colleagues take on.
Okay, I think we're good here. I'm going to go ahead and let Robbie pick it up and talk about our partnership, and I'll interject in a minute.
Good afternoon, and thank you so much to the Eye and Ear Foundation for asking me to be here. This is an unusual panel, I think. We became involved with this project really through happenstance. I received an email from Carrie Fogel asking if this was something that my team did, and we have quite a bit of experience in developing therapy gardens and different type of sensory gardens throughout our coverage area. And I was certainly happy to add this to our list. So I met with Rachelle and Carrie and Lonnie Snyder. And I was immediately taken by how incredible the school is and how they interact with their students and how they have this horticulture therapy program at the school. And Deb Frank was at that meeting as well and impressed me so much with how she integrates plant material and colors and textures into their therapy. So I approached my leadership at Dudek and Kelly Knoll, who are always 100% on board with everything, as well as Mary Gagu from the Mercy Engineering and Maintenance Department. Without his support, we wouldn't be able to access the gardens and do everything up there. And of course, that entire team was immediately on board. Because it's such a fascinating and great program that we wanted to be a part of it. So those gardens were taken over for the students to plant, design, and work in. They come to the facilities on average once a week, and they work with my team in weeding, planting, harvesting, and interacting with the other employees and patients on that floor. So it's been a real honor for me and my team to be involved in something like this. And Rachelle, if you want to do the next slide.
Well, absolutely. Thank you for having me here. I'm truly honored to be here. I appreciate the partnership we have with UPMC's Eye and Ear Vision Institute and just the way they've supported our school. not just financially, but with giving of their time. And I think that's so valuable. And I know that that contributed to the success of this partnership. We were just commenting, there's just been a little bit over a year since we started, if anyone was curious. And I know that our students and our adults in our adult program, we have a student population and we also serve adults. Our board is extremely committed to what they have in our strategic plan, and that's a commitment to a lifetime of learning. And so that's really where this conversation generated from, and it is in our adult program that we are working on expanding opportunities for adults with need throughout the Commonwealth. And it was just an innocent conversation, as Ravi had said, that brought us all together. And it's just been a joy to watch how our students are thriving in another environment off-site, away from school, away from adult programming. And they've certainly gained a lot. I am going to play a short video about our school students so you could hear firsthand on all the attributes that they have and how they are able to use their abilities and engage with their environment. And it just, let's see if I can get this in here. Well, after this.
I would say that an average day here it can be hard to explain to someone who's never been here before. It's filled with kids that very few people have the opportunity to interact with.
A normal everyday at the School for Blind Children is amazing. I think joy is kind of how I would describe it. And when you enter the classroom and when the children enter the classroom, they're so excited to be here. And I think that energy is contagious. It makes us excited to be here.
Well, this is unlike any place I've ever worked before. You know, it's such a welcoming community that we have here at the school. And, you know, we know that we're working towards one goal, you know, and that is to serve our students. And so everybody is just nice, you know, and they all sort of support each other in any way that we can. So it's just really a wonderful place to be.
The Western Pennsylvania School for Blind Children has been in existence for 135 years. It was originally founded to support children with blindness and visual impairment and continues to do so 135 years later. We serve roughly 500 children and young adults from all over Western Pennsylvania.
At the Western Pennsylvania School for Blind Children, we are very lucky to have a team of professionals as well as paraprofessionals that all work collaboratively towards meeting the child's educational goals.
When you go into a classroom, oftentimes you won't be able to tell who is in what role because everyone is working together so seamlessly and the students are engaged and you can feel positive energy and a really welcoming environment.
We always say that that Abby is such a statistical anomaly. She is 0.5% of 0.5% of 0.5%. There's really very few other kids like her, and you could say that for all roughly 200 kids at this school. So there is no one approach for every child here. Every child is its own kind of complexity, mystery, and the staff here really do such an excellent job of finding ways to kind of bring out the abilities of every kid. They have a staff that's been here collectively for many, many years. And so if they've not seen a child like my girl, they've seen a child that's similar to her. And so they have a long history to draw ideas from.
People talk to me about the patience it would take to have to work here and how patient I must be. And I've never felt that before because I think my perception is obviously different. I understand the level of effort it takes for these kids to do what we might say is a really simple task. And we'll never understand the struggles that they're going through. But we just have to give them our best every single day. And when those successes happen, that's when it's all worthwhile.
When I think about the reasons that working at the Western Pennsylvania School for Blind Children matters so much to me, it's because we create a community where children succeed and we celebrate that.
Whether you are a student, a parent, an employee, a visitor, your heart will be moved and you will never forget the experience here. In some way, you take it with you and you never really leave. So if you haven't been on campus and you haven't visited us and you wonder what happens here, I invite you to come in. You have an open invitation and see just how special this place is.
The School for Blind Children is, and it is, like, it sounds corny to say, but it is kind of a magical place. And if you walk through the halls and peek in a room, you see it.
All right, I'm unmuted now. Thank you for watching and listening to that video. I think, you know, picture's worth 1,000 words, and I think that video is certainly worth millions more. We're just happy to keep our students engaged, and so that their learning and their educational performance is just enhanced by what we do. And so hopefully you got a little snippet of that. I appreciate Dr. Patil's discussion on CVI. About 70% of our children have cortical visual impairment as a diagnosis. There are other common diagnoses that go along with that. But we also have about 12% of our student population that's dual diagnosed as deafblind. And that's really important to the multisensory approach that you're going to see in the garden. These gardens were created with intention. As Robbie spoke earlier, Deb Frank is our horticulture therapist in the adult program. And she has a specialty in therapeutic landscape design. So we're going to take a look at what the space looks like and how it's been maintained by our adult program participants. I think you could see on the slide, there's certainly great visual contrast and the saturated colors. Of course, not just good for children with CVI, or as we heard Dr. Patil talk about the brain-based visual impairments, but also for anyone with a visual impairment. You know, movement is really good for children with cortical visual impairment. So you'll see wind chimes and slides that we have as well. And the raised flower beds really provide accessibility for all individuals that we have. They enhanced participation in the therapeutic endeavors, also with the rooftop garden. And I can let Robbie speak to that a little bit. I know that UPMC also uses the rehabilitation garden in a way with their patients and their occupational therapists.
Yes, so we developed a garden similar to this at Shadyside several years ago for people with traumatic brain injury to essentially relearn textures, sharpness, softness. So I worked with Deb Frank, who's amazing, and I learned so much from her as well as to what types of plant material is safe and tactile in visual. Taste and smell, all of the senses. So we planted things like lamb's ear and ornamental grasses for touch. I'm sure everyone's familiar with lamb's ear. Everybody has it as a weed somewhere in their yard, and it's very soft. Kids love it. So there's sections of the gardens that are designated for each of the senses. We also have corkscrew blue rush, something that has a little bit of sharpness to it to give them a little bit of a sense of color and feel. There's another entire bed dedicated to taste, which is the vegetable garden that has tomatoes, tomatillos, beans. There's purple beans and green beans for color differentiation. And again, my team and the students from the school and the staff maintain those gardens. For scent, there's jasmine, scented geraniums, mint, and it's all kind of broken down. I invite anyone who's in the area and can stop up to the 4th floor at the Vision Pavilion and check out what's done up there. It's absolutely incredible. And it is in the middle of the rehab section of the garden where patients come out and are rehabbed for other conditions as well. And then they get to experience the work that the students from the school have done. So it's a really incredible place if you have a chance to stop by and take a look at it in person. There are chimes. I think we're working on getting some sound up there. Through some limitations, but we're going to try to get some type of sound machine or something to include up there as well. But for now, the chimes suffice for that. So I invite anybody to take a look if you can make it there.
We also, in addition to all the textures that we have there are braille signs there available for people to enjoy too. So everything is labeled in print and braille for the population that we serve. The gardens are created through, our 4 seasons, and they're designed that way intentionally. So you can see some of what we have here. They certainly look a lot more beautiful right now because it's the summer season, and these pictures are representative of what had happened this past year. And as Robbie said, I know that people were out and enjoying all the vegetables too, and they're able to pick those and eat those as well, and just get the full experience if they wish. But it's something that I know our staff have really also appreciated being engaged in a different way. And I know I see the benefit of our students. You see the joy on their face, and just means everything to us. If you happen to have lunch indoors, right, before you go out to the rooftop garden, you might see some of the creations that are made on site by our adult program participants or our students. I use both terms interchangeably. We do grow the items here that we use in the rooftop garden, and they create those centerpieces, and they're at that grab and go cafeteria area using materials either from the garden or what we have back at the school on site. In order to do that and to help guide students and how they're using and planting and guiding the plug-in to get to the center of the pot, we do create using a 3D printer guides, and they were actually invented by our horticulture therapist, Ed Frank, and they're very easy. They don't take very long to create, but then our students can use those so they know tactually where to direct the plug, and certainly they're visually attractive as well, so it kind of serves a double purpose there. We did leave several of these throughout the garden, and so if you're there and you happen to see those little circles and you're wondering what they are, they might not all be yellow. Some of them we do make red. You'll know what they're for, and they're definitely for planting, so feel free to use those as you see fit.
So I've had the pleasure of now touring the school, I believe, 3 times. My most recent tour, I brought Kelly Knoll, who is one of the VPs of corporate services, to the school to experience, honestly, what is the magic of that school. And the hope is that we can continue the partnership, the collaboration for many years to come with many, many more students through the school. And also expand some opportunities for some of the adults in the school. Looking forward to, possibly seeing if there are employment opportunities within the system or even within my team for some of the students there. Developing volunteer groups who would be willing to assist not only with the horticultural program, but also with the students themselves, and continuing, of course, to maintain the garden and greenhouse. There is an incredible greenhouse that was maintained by Deb Frank at the school that I've had the pleasure of visiting several times, where the kids work and they plant and engage, and it is such a magical and incredible place. There are sound sculptures and things all over their campus for stimulus and just incredible. So my hope and my team's hope is that we can continue these programs well into the future with the support of our leadership, which so far is 100%. So I'm hoping that we can continue this, not just through this year and next year, but for many years to come.
I completely agree with everything that Robbie said. Our school was so committed to continuing education beyond, the students graduating at their 21st or 22nd birthday now. And we really are committed, the board is committed to providing a lifetime of learning. And so that's really where we're going with our next expansion. And it really is an expansion of adult services. And so that includes employment, volunteering. I think the hope, and this is why this partnership has been so beneficial to so many, is that we have a similar philosophy to UPMC's. And that is that we want others to see our students and to see our adults and realize the potential that they have, and to see hope and opportunity in them. And so I know that, not often are people receiving good news when they're leaving a medical facility. And I just want, if they're on their way out and they happen to see one of our, engaged, smiling students. I just want them to leave with that sense of hope and knowing that this is what they have to look forward to, and that there are opportunities for them. And so that's, I think, what makes me so proud of this partnership that we have. And just, I'm looking forward to seeing it continue to grow. I also hope that people can take away some of these ideas and use them in their own home with their own, if they have someone they're caring for, and just know that, you can have fun, exciting, creative ways to be engaged, and they learn at the same time, but they're really not aware that it's work. It's not, school. It's something fun. It's something to do as a family. And it's just, great for everybody involved.
I love seeing that photo. Those are some of our original gardeners the day that they came to first install the garden last year. And as you'll see in the corner, Dr. Sahel, he was a huge part of this. I want to make sure that I acknowledge that, because when we first came up with this, idea, we consulted with him, and he felt extremely strongly that we create a space for the students of the school to have at the Vision Institute. This was, the Vision Institute, it was very much influenced by his research and his work, and just his overall commitment to meeting the needs and the potential of all the people that we're here to serve. So he really felt strongly that we needed to make this space for this collaboration. So thank you all. I'm really moved by that whole presentation. And we have several questions, so I don't want to delay my remarks at all. I know that Dr. Patil, you have clinic today, so there are a few clinical questions that I'll probably ask first, and then I'll kind of reserve some of the questions about the collaboration for later. So whenever you have to head out, just let me know. So we have a question that asks if there is a genetic component to CVI. Could it be an inherited type of condition?
So that's a great question, actually. It's not typically thought of as an inherited condition. There is, however, some recent literature and some recent research going on into looking at genes for CVI. Interestingly, there are some genetic components that have been found. So they're mostly genes that are responsible for other neurodevelopmental disorders as well, and certain specific genes that could cause more of this neurodevelopmental damage and CVI with it. So that is an ongoing field of research. So that's a great question. There is most likely in the next few years we will come up with genes we can test for CVI.
Is that something that any of the teams at Children's Hospital in Pittsburgh are working on, or is that kind of happening all over the country in genetic research in CVI?
All over the country. So we are actually we're part of a CVI study as well. And while we haven't done any special genetic testing as a part of the study, that wasn't planned as a part of the study, but we certainly have data now on our primary group, which was 50 children that we've looked at exclusively with CVI, no other ocular issues. And we have the genetic data, which we are analyzing at this point. And there are certain genetic diseases we're finding there too. So.
Fantastic. And I believe that was one of the first programs we started together, that the study that's together with the Western Pennsylvania School for Blind Children, which is, I'll also say, generously funded by the Jack Buncher Foundation. And we've got, like you said, some great data. So I knew that was a part of it, but you said in these years, more and more will be coming out. So it's really an exciting time to kind of find out more about this previously, not so well understood condition. What percentage, if you know, of children with vision issues actually have CVI or are diagnosed with CVI?
That's a difficult question to answer depending on different resources. So for example, I'm sure, Rachelle, you'll vouch for this. If we were to study a population at, say, the School for the Blind, the percentage of children with CVI will be extremely high. I'm guessing 70-80%. And that's whereas if you looked at like a regular school or a regular outpatient pediatric clinic, the percentage would be lower. And that's what we see reflected in literature as well. There are estimates that about even 30% of children with vision impairment may have a component of CVI, which seems pretty high if you think about it, like 1/3 of kids with some form of vision impairment might have CVI. The NIH, though, the national body that oversees all research, is also now getting interested in CVI. And like you said, Carrie, this was something not as well looked at previously, but is a pretty hot topic now. And they put their figures at somewhere between 10 and 12% of children with visual impairment might have CVI.
Thank you. I think we have one more clinical question, so I'll go ahead and ask that. Is there any work being done in research or in clinical trials to regenerate brain pathways, reconnect them so that children with the CVI can have like a better chance at achieving some functional vision?
Not that I'm aware of.
Okay.
I don't think there's any regenerative work, not that I'm aware of.
I think, yeah, that may be a question just based in, regenerative medicine is also a hot topic. So wondering if like those neurons could be, regenerated or reconnected to kind of achieve some vision. So thank you. Then I'll move on to some of the questions about the garden. We do have a few more minutes, so I will encourage anybody in the audience to please ask just a couple more. And then we'll go ahead and wrap up. So we have a question about the garden and about how many hours or days per week, kind of the general schedule, does the average student spend in the garden at the Vision Center? Also, do they go just one-on-one? Are they there with support staff? Are they interacting with any of the ground staff and anybody else while they're there?
So that varies depending on the season and the needs of the garden. Obviously, spring is a pretty heavy time for them to be there planting, and they'll spend up to 5 or 6 hours there on a spring planting day. On average, right now, they come once a week for about 4 hours a day. They have their support staff with them, and also my staff is always present. So whatever they might need, tools, equipment, support, whatever is provided to them. So it really depends on the needs of the garden. They water, they prune, they trim, they harvest. Sometimes they just laugh. There's not much to do, so they just kind of hang out in the garden and enjoy the space. But that's an average. There's a lot more in spring and fall, not so much in the hot heat of summer. We also have to watch temperatures. That is a rooftop garden, and it can get extremely hot and dangerous, not just for the students to be there, but as well as staff for long periods of time. So they might be a half hour, an hour, then they have some snacks and head back. So it varies, but I would say, once a week or so, a few hours per week on average.
If you have the opportunity to meet any of the students that are working in the garden, any of the support staff, I've been really amazed at how much the staff at the Western Pennsylvania School for the Blind really enjoys coming with the students that they work with, and they take on a lot of the labor as they kind of navigate the garden, and they're doing a lot of that as well. And they all have such great attitudes. I really have, all of us at the Eye and Ear Foundation, at the Vision Institute, because as of where it sits, the low vision clinic and the physical medicine and rehabilitation clinic sit right there. And I know that they've brought a lot of joy to everybody kind of in the building. So we hope to continue to grow it. I know you talked about future plans. This is kind of phase one of this collaboration, and we hope to update everybody with maybe a webinar in a year or two, just to see kind of where we are in more collaborations around workforce development and visibility, and kind of tapping into the potential that all of the students have and the adults have that are part of the school. Last question. How are the students transported back and forth between the school and the Vision Institute?
Oh, that's a great question. And certainly in the adult world, that's the biggest barrier, I think, to anything is transportation. We do have some school vehicles that we use, so we do share those with the school program. We're looking to get a vehicle for the adult program so that we can, have just access to the community. We know that participating in community events and volunteering and employment is that's really the next step that we're looking to grow. And so that's part of that plan, is to purchase our own vehicles so that we don't have to worry about, relying on access. Or for students that would, our day program, we do have students from 4 different counties, and that makes it a little bit more complex because they're not all in Allegheny. So it's just easier for us to do it. And then we could just rely on ourselves.
And then to add to that, once they're on site, the parking department has been amazing in assisting with the valets and assisting the kids on and off of the transport vehicles, and making sure that there's always room for them. So they're supported from the minute they leave the school until they leave our facility again.
That is really important and not to be underestimated, given that both the school and the Vision Institute are in, heavily urban areas of our city where traffic, parking, construction can get tricky. And when you're dealing with people with some physical limitations, that's really important that the space is made for them to kind of get in and out safely. I think that's our final question. So I'll wrap up here. Again, thank you, Roberta. Thank you, Dr. Patil. Thank you, Rachelle. We look forward to updating everyone as we continue this partnership with more exciting news. So thank you all. Thank you all for spending your lunch hour with us. Take care and have a good afternoon.